Sir, what's the natural course of an autism spectrum disorder if left unattended or not treated? What will happen while the on the as the time goes? Whether the kid gets better due to any of the factors, or how far it will go? What will be the prognosis of that case?
See, what will happen to an autistic child if he or she is left unattended? That depends on many factors. See, if the child is very mild in the spectrum, with consistent trainings and therapies, I think the child may be able to lead a normal or near normal or at least an independent life. But that need not be the case with most of the real life situations. Child is born or diagnosed with an autistic or an autistic child normally grows to an autistic adult with lots of dependence in daily activity, in profession, in job, or whichever area he or she is getting engaged with. So that is the fact. Meantime, I think, see, as I mentioned earlier, the autism is not going to be a life-threatening condition. So obviously, I think he or she will have to live with it, and that may require a lifelong support system,
and the quality of the life also.
That also will be, but it is there can be differences in the grade or the severity regarding the support that he or she requires, but generally you may not be able to withdraw that system completely.
Sir, what's your opinion about the conventional approach on autism and its merits and demerits and the recent developments, and where can we space the system like Ayurveda or the traditional wisdom, and how can it exist together, or how can they exist or coexist?
See, the conventional, I hope that what you mean by conventional is the see, it is not a medical, it is not considered as a medical issue.
Yes.
So I think you can't say that the allopathic
no sir, including every
approach.
other support you said.
Yeah, so there are many methods. So which is conventional, which is unconventional is always a troubling question. We say maybe on the other way, we can say that an Indian approach and a non-Indian approach, or Ayurvedic and non-Ayurvedic approach, these sort of separations may be more realistic. And this, to be very honest, they are all complementary. But at the same time, there are many therapies coming up every day. You name it, we have it. That is the way in which things are coming up. That therapy, this therapy, pet therapy, all these things will have their own advantages and their own disadvantages. When done with purity of intention, with lot of effort and experience, I think all these things are going to work, because all these things are part of our social day-to-day life. So any exposure, as far as the child is concerned, to a real social situation is going to be of some therapeutic value, some healing value. So that is a fact. Meantime, I think, see, Ayurveda has got a different perspective, which is more holistic that way, because it is considering the emotional aspects, the social aspects, the physical aspects, and it has got the flexibility also. It has got the flexibility to work in tandem with other therapy schools, like, see, Ayurveda with occupational therapy, Ayurveda with speech therapy. There are no areas where they contradict. So that way, I think it is perfect. It is a perfect blend to have Ayurveda on one side and the other therapies coming on converging together to complement. I think it will be the best model. It will be the ideal model which can do wonders if done in a systematic manner.
Sir, as you said, the management of an ASD case or an autism case, it is multifaceted. The family persons will be involved, the relatives will be involved, the nearby persons will be involved, the teachers will be involved, and the common society also is involved. So what is your message to the common society while dealing with the autism case? What all care they should take as a common person?
See, two things. Number one, I think we should work harder to control the incidence of spectrum children. For that, I think we have to go back. I think, see, as I mentioned earlier, we have to sit back and understand our body properly. So, I think many things should be there in the priority of the society about healthy pregnancy, healthy childbirth. That healthy is not based on the medical parameters, but about the developmental, then the emotional, the cultural, all inclusive aspects of child development. That is the most important thing. Once it is not happening, then obviously there is an autistic child with us. Now it is coming to the care. Then I think the awareness about the problem should be there at every levels of the society. The society should become more inclusive, more understanding about the real problem, and definitely I think if you keep the pace with which it is increasing at present, see the tomorrow or day after, we will have to learn how these individuals can be converted to productive, independent members of our society. So, definitely that is going to be a question, a challenge to the society, not to these individuals. See, on the other side, it is going to be a principal consideration of a topmost consideration as far as the society is concerned. So, every member of the society should be understanding what is this and how this can be addressed, or how a person with that sort of a special behavioral pattern, a different behavioral pattern can be accommodated in the society, how she or he can be effectively placed in the society, and how can we help him or her to be independent in their personal lives. So, all these things are to be seriously thought about.
Thank you so much, sir, for your precious time and
Thank you.
sharing your valuable thoughts on the
Thank you so much.
autism.
Thank you.
Thank you.